Kick counting documents fetal movement patterns and can provide mom and providers about changes in fetal status. Kick counts are generally started around 28 weeks gestation. Kick counts should be performed at the same time each day. Mom should sit with her feet up or lie on her side, and she counts any type of movement felt from the fetus until 10 are felt. Kick counts can be done for up to 2 hours, but most fetuses should reach 10 movements long before that time is up. If a fetus doesn't achieve 10 movements in the 2-hour period, then the mother should try to wake the fetus by taking a brisk walk or drinking fluids and then repeat the count. If the fetus still does not achieve 10 movements in the 2-hour period, then the provider should be notified. The non-stress test is one of the most common methods of prenatal screening. The non-stress test is performed by auscultation of the fetal heart rate using an electronic monitor for approximately 20 minutes. Acceleration of the fetal heart rate during fetal movement is a sign of fetal well-being. An acceleration is defined as an increase of 15 beats per minute lasting 15 seconds in fetuses after 32 weeks. If the fetus is less than 32 weeks, the acceleration is an increase of 10 beats per minute lasting 10 seconds. The interpretation of the fetal heart rate tracing should follow a systematic approach with a full qualitative and quantitative description of the following: the baseline rate, variability, presence of accelerations, presence of decelerations, changes or trends in the fetal heart rate over time, and the frequency of uterine contractions. A reactive non-stress test has 2 or more fetal heart rate accelerations within a 20-minute time frame. A non-reactive test does not have 2 accelerations within the 20-minute time frame. If this is the case, the test can be extended for another 20 minutes. A non-reactive, non-stress test indicates a need for further testing. If the pattern is non-reactive after 20 minutes of observation, then vibroacoustic stimulation using an artificial larynx may be performed. It is used as an adjunct to tests of fetal well-being, such as the non-stress test. The acoustic stimulator should be positioned on the maternal abdomen, and a stimulus of 3 seconds or less is applied near the fetal head. If the non-stress test remains non-reactive, the stimulus is repeated at 1-minute intervals up to 3 times. A positive result means that the infant has achieved a 15 by 15 acceleration in response, and a negative indicates that no acceleration was achieved. The biophysical profile combines electronic heart monitoring with ultrasonography to evaluate fetal well-being on multiple variables. Each category receives a score of 0 or 2 points. There is no scoring a 1 on this test. The fetus either meets criteria or it does not. The total score is then used to determine fetal well-being. A score of 8 or 10 indicates fetal well-being. A score of 6 is equivocal and requires follow-up in 24 hours, and a score of 0, 2, and 4 are abnormal. This chart shows the components of the biophysical profile, and the definition is shown where an infant receives 2 points. If the infant does not meet these definitions for each component, then they get a score of 0 in that category. The modified biophysical profile combines a non-stress test with an amniotic fluid index. The amniotic fluid index is an indicator of long-term placental function. The deepest pocket of fluid in all 4 abdominal quadrants is added up to get the amniotic fluid index. An amniotic fluid index of greater than 5 is considered adequate volume of fluid. A test is considered reassuring if the non-stress test is reactive and the amniotic fluid index is 5 or greater. A test is non-reassuring if the non-stress test is non-reactive or the amniotic fluid index is less than 5. The modified biophysical profile is less cumbersome and appears to be as predictive of fetal status as other approaches of biophysical fetal surveillance. The contraction stress test is based on the response of the fetal heart rate to uterine contractions. An adequate uterine contraction pattern is present when at least 3 contractions persist for at least 40 seconds each in a 10-minute period. Uterine stimulation is not necessary if a patient is already having spontaneous uterine contractions of adequate frequency. If fewer than 3 contractions of 40 seconds duration occur in 10 minutes, contractions are induced with intravenous oxytocin. A spontaneous contraction stress test can be considered if the adequate number and strength of contractions are noted in the 10-minute time frame. The contraction stress test is interpreted according to the presence or absence of late fetal heart rate decelerations. The results of the contraction stress test are categorized as follows: negative, has no late or significant variable decelerations; positive, has late decelerations after 50% or more of contractions, even if the contraction frequency is fewer than 3 in 10 minutes. Equivocal suspicious, the fetus has intermittent late decelerations or significant variable decelerations. Equivocal, the fetal heart rate decelerations that occur in the presence of contractions more frequent than every 2 minutes or lasting longer than 90 seconds. Unsatisfactory, fewer than 3 contractions in 10 minutes or an uninterpretable tracing. Contraindications to the contraction stress test generally include conditions that are also contraindications to labor or vaginal delivery.